Hello everyone, today we'll be talking about how to best use the iPen. First, allow me to introduce myself. My name is Karim Fahmy. I'm a Senior Associate Product Manager at Admate Pharma. The iPen, it's an amazing device in terms of accuracy and reproducibility. But as said, a device, so there is a technique to follow to reach this accuracy and reproducibility. Before performing the osmolarity measurement, there are a couple of factors that we need to take in consideration. For example, room temperature. Osmolarity is best measured when the room temperature is anywhere between 15 and 25 degrees. So if the temperature outside is above 30 degrees or below 0 degrees, patients should be allowed to rest for 15 minutes to have a proper acclimatization. So what should be avoided? Patients should avoid wearing makeup or contact lenses because they may have an effect on osmolarity. Patient is then requested to remove them and wait for 15 minutes because the process of removing them is actually a physical process that may lead to osmolarity change. Do not perform invasive testing or slate light exam before osmolarity measurement. For example, dry eye patient having high osmolarity. By performing an invasive testing, this will lead to increase in tearing and decrease in osmolarity, leading to false negative results. The other way around with the slit light exam, if the patient has normal osmolarity, then requested to open his eye for a certain amount of time, leading to excessive evaporation, this will increase the osmolarity, leading to false positive. Finally, stay away from any procedure that could increase or decrease tear volume, like lubricant drop, staining drops, irritant, or crying, because this will lead to a decrease in osmolarity. If this happens, we must wait for 2 hours. So, how to perform the reading? First, the doctor must have a top view of the patient's eye to properly see and reach for the lower conjunctiva. We accordingly recommend the doctor not to be standing but seated in a position that is between 10 to 20 centimeters higher than the patient. We also recommend that the hand holding the iPen should rest on the patient's face to increase accuracy. Also, keep in mind that measurement is accurate when it's done in the middle of palpebral conjunctiva, with the iPen's SUS touching and approaching the conjunctiva with a right angle. Finally, the angle of measurement should be anywhere between 0 and 45 degrees for proper measurement, and just a light pressure or power is enough to ensure and secure a proper contact between the iPen's SUS and the conjunctiva. Just before the test, ask the patient to close their eyes for 30 seconds. This will reset osmolarity for accurate measurement of real osmolarity.
Hello everyone, this is Karim Fahmy from Admate Pharma, and this is my dearest colleague Frédéric. We're here to do a demonstration of the iPen. But first, let's go over a couple of things. First, the temperature should be between 15 and 25 degrees, which is the case. The patient should be allowed to rest for 15 minutes when he comes into the clinic, and Fred has been here for more than 25 minutes. That's good. She's not wearing contact lenses, she hasn't been using eye drops since this morning, and we haven't done any kind of invasive procedure yet. Always remember, iPen should always be the first assessment to do, the first measurement to do. So before we start, 2 things to do. First, you should be in a slightly elevated position, like 10-15 centimeters above the patient to have a good view of the eye and conjunctiva. Then ask the patient to close her eyes for between 30 and 60 seconds. Can you please close your eyes? So, where should I put the SUS? The SUS should be put exactly in the middle of the palpebral conjunctiva with appropriately light pressure. Too much pressure on patient conjunctiva will hurt him and lead to an error. Too light pressure will not allow a proper contact between the tip of the SUS and the conjunctiva. What about the angle? The angle should be anywhere between 0 and 45 degrees. And last, but also very important, the hand holding the pen and making the measurement should not be suspended in the air. So I'm going to use my left hand to lower the patient eyelid, turn on the iPen, and use my right hand. I'm going to use one finger so I have a proper contact with the patient's face, and then do the reading.